Hi, my name is Caitlin Smith.
I'm Elizabeth Hayes.
And I'm Mackenzie Fife, and we are all undergrad students at Georgia College and exercise science majors, and we are doing this for a applied research class. And our research critique is on examining the effect of increased aerobic exercise in moderately fit adults on psychological state and cognitive function. It is known that exercise can help with weight loss, strengthen muscles, heart disease, etc. But not much is shown on the cognitive benefits that can be provided. There are many studies on exercise and cognitive function in children and elderly people, but there is limited research on the improvements of cognitive function in healthy adults. When saying healthy adults, it means people who have a regular exercise regimen and are before the onset of aging, when their brain health is still adequate. The purpose of this study was to see if doing more aerobic exercise on a regular basis would benefit the cognitive function of these healthy adults. And the purpose of this study was to find out if increasing aerobic exercise in these healthy adults would have any effect on cognitive function and psychological state. And they specifically wanted to do this study with healthy adults from 25 to 59 because they wanted to do it before the onset of aging and neurodegeneration. And they hypothesized that the participants who were increasing their exercise program would benefit more in their cognitive function and psychological state compared to the participants who kept their same exercise program and didn't increase anything. And when they were talking about the increases in their exercise program, they were specifically focusing on the cardiorespiratory aspect of it. And this study was a randomized control study that included fitness tests, self-report questionnaires, and cognitive function tests. And for the fitness test, they did these before and after the study, and it was a submaximal cycle test. And during these, they were specifically focusing on heart rate of the participants. And for the self-report questionnaires, they were using these to assess the effective state, eating altitudes, body image, and exercise motivation of all the participants throughout the whole study. And then they use 5 different tests for assessing cognitive function, and they all obviously were testing for cognitive function, but they all had very different aspects to the testing.
So there was a total of 130 participants who were moderately fit adults from the ages of 25 to 59 that participated in 1 to 2 aerobic exercise sessions per week. And they were excluded if they had currently smoked, had back, hip, or knee issues, or other pre-existing health conditions. And this was for a safety and injury prevention. And smoking was also part of it due to its effect on the cardiorespiratory function. And then they were also excluded if they had current diagnosis or taking medication for psychiatric or neurological conditions. And they all gave informed consent before participating in any of the exercises. And after the final analysis, there was a fine total of 80 participants. They were recruited through online and flyers through Austin, Texas, and they could not have any health issues that would increase the difficulty to exercise. They were randomly assigned, and the participants either maintained their exercise regimen or increased it for 3 months. In the control group, they took on their current exercise regimen and took 1 to 2 cycling classes if their screening was not accurate or adequate. And then the experimental group increased the regimen to 4 to 6 to 7 classes per week. And then a screening questionnaire was given to the participants, asked questions regarding exercises, how many days they exercise, and the level of intensity of the regimen. And then there was research personnel who determined whether the participants were moderately active or not. And then all the classes took place at Ride Indoor Cycling in Austin, Texas. Cycling classes were 45 minutes, and the participants were given a wrist-based heart monitor from MioFuse, and they monitored their heart rate during the class and self-reported other exercise sessions that occurred outside of the cycling center. And it was assessed at the beginning of the study and after 3 months. There was no difference between the groups in ages, gender, or education. And then the experimental group increased their exercise amount while the control group maintained theirs. And then the aerobic capacity of the control group was 3 points higher than the increaser group, proving that both were moderately fit. And the psychological measures of the experimental group decreased, which correlated with the cycling, while the non-increases group had a non-significant decrease, and then both decreased their reaction times and increased in spatial navigation tests and mnemonic similarity test scores. And the total cycling workouts correlated with improvement in seek duration.
The study has linked together how an increase in aerobic capacity can lead to an increase in cognitive function and psychological state. By using this randomized control study shows that improving a current exercise regimen can lead to a decrease in levels of general negative effects, and an increased aerobic capacity can benefit both cognitive and psychological health. Our critique is that this article was a well-orchestrated, effective study and was able to find that an increased exercise does have benefits for psychological state and cognitive function. The study, however, had a high dropout rate, which can be related to the remoteness of the study. And because of this, it caused problems in the study because there was data missing. The controlled and experimental groups were not distinctive enough to be able to see the increased exercise regimen. And the only difference in the new exercise regimen was 2 or 3 extra sessions of cycling. If there had been a greater difference, then there would possibly be more distinctive results regarding the two groups. There was a weakness in the time frame of the study due to there only being a 3-month time period, and there was not enough changes in the hippocampus to see if there was a full change regarding cognitive function. For future research, there should be a longer amount of time as well as testing for improvements throughout the time of increased or maintained exercise regimen, as well as finding a way to keep participants in the study to prevent dropout rates, as well as have in-person assessments and accountability. JB is a iThrive Scholar. The iThrive Scholar program is supported in part by the National Center for Advancing Translational Sciences of the National Institutes of Health.